Hello, everybody. Andrea Twarowski here with Dentalelle Tutoring. This is actually a question from a YouTube commenter, which is awesome. Her question was, how do you properly go through a medical history and what types of questions to ask? And this is an amazing question because in some offices, the medical histories can be quite long, and in some, they can be quite short. And it's not something they train you on per se, other than your maybe first semester, second semester in school, and of course through clinic. But things are different when you're in clinic because you have 3 hours for that whole appointment. Whereas in a dental office, you have 5-10 minutes, right? So it's good to kind of know what questions to ask further, because I've been in the dental field for about 13 years now, and sometimes I'm spending a good solid 10 minutes, half an hour on a medical history, whereas other times I'm looking for maybe a second or two, and that's it. So it's good to kind of have an idea, especially when you're first getting started, because you may not know the questions to ask or what to look for. So first and foremost, with the medical histories, if the patient answers yes to anything, you need to ask further questions. So a good example is a lot of people do answer yes to things that they may not have had to. So for example, I had a patient the other day. There's a question on most medical history forms that says, are you presently under the care of a physician? And a lot of patients say yes, because what they think that means is, are they being seen by a doctor at least every year? But that's not actually what that means. So that question means, are they seeing the doctor every month, every 2 months? Do they have to go through tests? You know, that is what that means. So if the patient actually does circle yes, and they are under their doctor's care, you need to ask more questions, because if they're seeing their doctor every 3 months, there's a reason for that, right? It could be because they have some kind of a sickness and the doctor isn't sure what it is. It could be because they're an uncontrolled diabetic, and the patient just doesn't take care of themselves properly, so the doctor is monitoring them over time. It could be because the patient has low iron. That seems to be a very common one, where they're seeing the doctor every 3 months for either some iron shots or to check their iron levels. So there's many different reasons why a patient may be seeing a doctor more often than once per year. So if the patient circles yes, you need to ask further questions. You can't just simply say, oh, okay, and then move on. You need to know why they are seeing the doctor so often. Another one is where there's a question that says, are you currently taking any medications? If the patient says yes, but isn't sure of the medications, and that's a very common one, you need to ask them further questions, because you need to know what the medications are, and you need to know why they are taking them, because there are so many different types out on the market where they could be taking a medication to, let's say, stop smoking. But that same med could also be used for something else. So even if you see a medication that you think you know what it's for, always ask, you know. And sometimes the patients have no idea. Sometimes the patients will say to you, well, I'm taking this, this, and this, but I don't know why. Well, they should know, but sometimes they just simply don't know why. So then you have to look it up on the internet, and it will typically give you reasons why people are taking that medication. So then you could say to your patient, well, are you taking it because you're a diabetic? Are you taking it? It could also be used as an antidepressant, you know, something along those lines. So you need to know why they're taking it. And then they may say to you, well, I'm not a diabetic, I'm depressed, so you know what, it's probably for that. Or you may have found out something new. You know, if they say, well, if that medication is for depression, well, I am depressed, so maybe I'm taking it for them. But perhaps on the rest of the medical history, it doesn't mention anywhere that they're depressed, right? So it's nice to put things together, because sometimes patients don't know how to fill out the medical history. So that's why it's so important that you know the questions to ask. Another common one seems to be a question about mental health. So if the patient circles, yes, I am under the care for mental health, you need to ask what for, because it could be because they're anxious. It could be because they're being looked at, you know. It could be because they're depressed. It could be because they're schizophrenic, bipolar. There are many different reasons why somebody may be under mental health care. You know, I've seen patients where they're under mental health care, they're seeing a therapist because they're anxious, but that's it. Or I've had some patients that are under the mental health care, they're seeing a therapist because they're depressed and bipolar and schizophrenic, you know, so it's good to know all of those things. Another common question is, have you had any seizures? If somebody circles yes, this is a very important question, because there are several things that now you have to ask. First, you have to say, when was your last seizure? If they say it happened 30 years ago, that's not something to be concerned about. If they say it happened yesterday, then you also need to ask, well, how often does this happen? If they say, well, I have a seizure every week, that's pretty serious. If they say, well, I did have a seizure yesterday, but I didn't have one for 10 years, you know, it's still something to be concerned about, because they just had one yesterday, but not as concerning as if they're telling you they have a seizure every week. Also, if they say that they had a seizure yesterday, then you need to ask them, well, did you have it looked at? Have you been to the hospital? Have you been to the doctor? What did they say? Are you currently taking any medications for that? Are they looking into it? You know, things that you do have to know, because in some cases, if a patient, let's say, had a serious seizure yesterday, you may not want to see them. You may say to them, well, until you have it under control, or until they know the cause, I don't feel safe treating you. Or in some cases, it may still be fine if they say to you, well, the doctor told me that I had a very minor seizure yesterday. They're not concerned. The doctor said that it was because I got too hot and was exercising too much. I don't know. That's a horrible example, but you get the idea. You always have to ask more questions. And if you're ever not sure, it doesn't hurt to ask the dentist. You know, say to them, my patient had a seizure yesterday. The doctor doesn't know why. They feel okay today, but do you think that I should continue on? Typically in that case, he or she, the dentist will say to you to take the blood pressure and then to go from there. Because if the blood pressure is overly high, then you may not want to see them anyway, because there still could be something happening, right? But you know, even having that said, a seizure isn't as serious as, let's say, they had a heart attack yesterday. You know, that's something a lot more serious, but still, a seizure isn't normal, right? It's not normal. So you still have to ask further questions. The only time that I'm typically not concerned is if they say, well, I did have a seizure 10 years ago, but I haven't had one since. If they're not taking anything for it, then they are probably going to be okay, but it's still a good idea to ask questions. Another question, a lot of patients typically circle yes to if they've had any surgery, but then they don't tell you the type of surgery. So you do have to ask. You know, this may be a little bit uncomfortable if you're new at this whole thing, but you do have to ask. And, you know, I think it's kind of self-explanatory that if you circle yes to having surgery, the patient should know, well, they need to know what type of surgery. You know, it could be surgery on their finger. It could be surgery on their neck. It could be, well, they had a heart attack and had to have surgery. You know, you just never know, because the patients sometimes don't think that teeth and health go hand in hand. So you still have to ask these questions. Like I had a patient circle yes to that question. And when I had said, well, what type of surgery did you have? He said, well, I had a heart attack last year. Yet nowhere else in the medical history did it say he had a heart attack. So it's a good thing that I did ask the question, right? Because that's pretty serious, something you have to know. Because if they had a heart attack, let's say 6 months ago, you cannot see them. It has to be at least 6 months after the heart attack, okay? Because things could be happening in there, you know what? Who knows, right? So you need to ask these questions. Another one that I had before was a patient circling yes to having surgery, and they had a cancerous tumor removed from their lung, I believe. But nowhere else on the medical history did it say they had cancer. That's pretty serious, right? So you always have to ask questions. Another common one is a question about if they have an issue with their thyroid. If they circle yes, you need to know if it is hyper or hypo. You know, just things you have to know. Levothyroxine, if I'm saying that right, is a common medication for that. But typically, patients will say to you, well, I'm taking a medication for my thyroid, but I don't know which one. So if you say, well, does it have to do with levothyroxine? They may say, yes, that's it. Or they may say, no, that's not it. You know, so then you have to ask them and try to figure out what they're taking. In some extreme cases, like if they have no idea, then say to them, as soon as you get home, phone the office and let us know all of the medications, because you do have to have that on file. You do have to have the full name, how often they take it, and the dosage also. So there's lots of things that you do have to know. Let's see, guys. I'm just trying to think of some more common questions. So as I said before, just typically if the patient answers yes to anything, you need to ask more questions. Let me think. I'm currently on holidays at the moment, so it's been a while since I went through the medical history, so I'm just trying to think what else. Because in our office, we update the medical history every 3 years, and they have to do a new one, or I should say they have to do one at every single new patient exam. So I'm just sort of going through that in my head and thinking of the common questions and the common things that I typically have to ask further. Another one is that if you ask on the medical history, do you have high or low blood pressure? And they circle yes, you have to know which one. So is it the high blood pressure or is it the low blood pressure? And you also have to ask, are you taking any medications for that? Yes or no. If they are, the next question that you have to ask is, when you are taking the medication, what is a normal blood pressure for you? Because I've had patients say that they're taking a medication for high blood pressure, and their normal is 140/86. You know, that's high, but that may be normal and, you know, a high normal to them, okay? Because if they say, well, if my blood pressure reaches 155, then I know that I do have to go to the hospital because something's wrong. But 145, you know, to me is normal, because you have to remember that normal is 120/80. But if a patient has high blood pressure and is on medication, the normal for them may be higher than the average. So that's important to know. Plus, if a patient does have high blood pressure, check it at every appointment because you need to make sure that they are okay. And don't only check it once, check it at least twice. Because I had a patient, he was actually the husband of a hygienist at the office. His blood pressure was 160/80. That's high. And he didn't seem concerned. He said, well, that's normal for me, but that is still high. So I said to him, well, I'll check it again in a couple minutes. So I waited about 5 minutes, and then it was about 148/86, I think, 87 maybe. So that made me happy, but it's still high, right? So if you're not sure, check with the dentist and say to them, you know, their blood pressure was this. So I took it 5 minutes later, and then it was this. Their pulse seems a little bit high too, but I think it's because they're nervous, you know. So think about all of those things. Plus, if the patient has low blood pressure also, it doesn't hurt to check it at every single appointment, because if it's too low, then if you sit them back, they may say to you, I feel kind of dizzy. I think my blood pressure is too low, right? Because if a patient has low blood pressure, that's not a good thing either. Because if you sit them up too quickly, they will probably say to you like, whoa, I don't feel so good. I'm dizzy, I'm gonna pass out. So it's so important that if a patient has low blood pressure, don't sit them up too quickly, and make sure they, you know, after you sit them up, make sure they just sort of take it easy and sit for at least a moment or two, because there are a lot of patients out there who you will sit them up and then they're like, okay, I am all set. And then you're like, whoa, wait a minute, just take your time. You have low blood pressure. If you get up too quickly, you could just kind of pass out, right? So just take your time, because some patients, of course, are anxious to leave, but especially somebody with low blood pressure, they need to take their time, because if they're laying back for 45 minutes, you sit them up slowly, that's awesome. But then if they start to sit up right away, then that's not helping them either, right? So think about the ones with high blood pressure and low blood pressure also. Let me think. What's another one? If the patient circles yes to having a reaction to local anesthetic, ask them more questions. Because sometimes it could be topical, it could be local. They could have had a reaction when they had their wisdom teeth taken out and they were put to sleep, because that's not local. That is general anesthetic, so that is something different. Nitrous oxide. Some patients think that's local anesthetic, but it's not, right? So always ask them questions. Say, well, what happened when you had that reaction to local anesthetic? And then they may say to you, well, when they put on the laughing gas, I felt a little bit funny. Well, that is not having a reaction, right, to local anesthetic. That is how you're supposed to feel with nitrous oxide. But sometimes patients just simply don't know, right? Or they may say to you, well, when they put me to sleep, you know, this, and this happened. Well, that's not local anesthetic. So always ask the questions. I thought of another one. If the patient circles yes to having an allergy, ask them questions. Is it seasonal allergies? Is it they're allergic to penicillin? Is it they're allergic to bananas? You know, ask them questions, because I've had so many people say to me they don't have allergies, but then when I ask them, do you have any allergies to medications? They may say, well, yeah, I'm allergic to penicillin. That's an allergy. But I think they think we're asking them if they have seasonal allergies or food allergies, maybe, but always ask them questions, you know, because that's so important. Because there's a lot of patients out there that are allergic to penicillin. So if they ever need antibiotics, you can't give them penicillin. But if they say that they do have an allergy, ask them what happened. You know, if they say, well, I took penicillin when I was a kid and I got a rash, you know, that is still an allergy. But if they said to you, well, when I had penicillin, my heart stopped. Well, that's a lot more serious, right? So you need to make notes of all of these things. Okay, guys, that's kind of all I can think about at the moment. I do hope this helped. Just kind of thinking for a second if there's any other serious questions. I'd say those are the most serious, and those are the common questions where patients just don't know how to answer them properly. So I do hope that that helped. To end off, just remember that if the patient answers yes to anything on the medical or the health history, ask them more questions. Don't simply say, oh, okay, and then move on. Ask them more questions. So I do hope this helped, and stay tuned for the next video.